We can't expect patients to come to Albuquerque, where we have the medical center. We need to really understand, how are they doing it in the rural areas? It really requires that we go into the community and find out, what does the community say they need? What would they like to know and do differently? Where do they feel the educational needs need to start from? So I do believe that part of the solution is, first of all, finding out what the communities need, and that each community is different. We have a lot of indigenous populations, and respectfully so, we need to go in to understand.
With my background and my family and that kind of thing, the rural medicine really sparked something in me to get involved in, as well as the School of Nursing. They also have a program where they send the students to the 2 different reservations to do rural medicine education. So now these students we're educating are serving those communities. And so I think that's a big reason why we did a donation to the Sandoval Nursing School, because it really provides access to those specific nursing students.
It's collaborating with people within the community that can help support the health of the community at large and help meet the needs of the people that live here together.
In order for us to bring New Mexico up to a higher standard of healthcare, we have to be able to have things like this available to us. Otherwise, we're missing out on culture and communities that have their own people and their own desires within their community to look after their communities.
I feel like New Mexico needs more of like a diverse workforce in the health field, so that they can improve their access to health in the rural areas. And I believe UNM College of Nursing is doing that by having like a diverse school, a diverse student body that can help to solve that problem.
There's all ways that we can collaborate with communities that are underserved and helping to make the care, they have access to care that's patient-centered and good.
People here in New Mexico are very generous of their time and of their money. They're willing to really come to the table and try to find those solutions.
After I was accepted at the university and was granted the Blue Cross Blue Shield Award, for me, I was diagnosed with a very large brain tumor and had to have it removed. And I wouldn't have been able to work at all, and I would have had to have dropped out of the program. It was a godsend for me, really. It was very important, and it's allowed me to continue on. It's allowed me to go to school for getting treatments.
My main worry was how I was gonna afford it financially. And when I got the Blue Cross Blue Shield scholarship, it kind of relieved that stress that I had about not being able to afford it.
Achieving higher education is not accessible to everyone, unfortunately. And donations and gifts and scholarships help with inclusivity, and it helps with the diversity of our healthcare teams. And that makes our healthcare teams stronger to address the unique needs of our communities.
I am actually an urban kid from the Bronx, New York, and I was the first generation going into the university setting. Somebody actually thought of the future of kids that were coming from the urban areas and donated. I think about it now, and I'm thankful, I'm grateful for those opportunities. So I look at that as an important feature that all philanthropists need to know, that they need to be connected to where they put their money and see the outcome. I can look back and say, nobody ever thought that I was going to be a dean, but here I am.